Hello everyone, welcome back to Mediquaries. Let's have a look at the FMGE Jan 2025 subject-wise recall of all the 300 questions. So FMG marks distribution, preclinical anatomy, physiology and biochemistry, each consisting of 17 questions, paraclinical, PSM tops with 30 questions, pharmacology, pathology, and microbiology, each consisting of 13 questions, medicine tops in clinical with 33 questions, surgery with 32 questions, obs-gynae with 30 questions, ophthalmology and pediatrics and ENT with 15 questions, and radiology and forensic with 10 questions. Orthopedics, psychiatry, dermatology, and anesthesia consisting of 5 questions, making up a total of 300 questions. So, this is the trend which is seen for the past 3 to 4 years of the FMG marks distribution. So, let's move on to the questions. First, medicine. IgM anti-HBC is associated with? Answer is acute infection. Next question. 6 months old child is noted to have muscle weakness, vitals, pulse, 80 per minute, BP 70 by 50 millimeters of mercury. Workup shows metabolic alkalosis with hypokalemia and hypomagnesemia. What is the diagnosis? Answer is Cohen syndrome. Next, what is A wave in JVP? Answer is atrial contraction. Question number 4. Graham-Steele murmur is seen in? Answer pulmonary regurgitation. Unstable patient with BP less than 90 by 60 with irregular pulse and absent P wave. Management is? Answer cardioversion. Next, first degree heart block. Answer is prolonged PR with normal QRS and P wave is seen. And next question with PFT findings of decreased FEV1 is given. And diagnosis is? Answer COPD. Next question, in a patient with mountain sickness, a drug was given and it acts on which part of the nephron? So the answer is PCT, and the drug in this case is carbonic anhydrase inhibitor like acetazolamide. Next question, a patient after head injury is opening eye to verbal response, localizing to pain and is confused. So GCS score is answer 12. Next question, swelling on the neck. Identify the group of lymph node. Answer is level 2 lymph node. So the image was given. And next question, a 12-year-old child was brought to emergency. Pain was radiating to the back. When on bending forward, pain relief was there. Which of the investigation will aid in the diagnosis? Answer is serum lipase. This is a case of pancreatitis. Next question, a patient with respiratory distress and absent breath sounds on one side and trachea deviated to the opposite side. So diagnosis, if at all tension pneumothorax and traumatic pneumothorax, both of them are given, then the most probable answer could be traumatic pneumothorax if there is a trauma involved. Otherwise, the answer could be tension pneumothorax. Next question, last link in ACL is chain of survival. Answer is recovery. Next, an image is given and a neck vein is dilated, and also it's a cord-like structure is palpated. So the answer to that is external jugular vein. It's an image-based question. Next, a patient presented with weakness of lower half of right side of the face with drooling of angle of mouth. He's not able to raise his eyebrows or close eyes on both sides. So diagnosis in this case will be infranuclear facial palsy on the right side. Next question, identify the defect in the image. So an image is given and the answer to that is 7th nerve palsy, that is infranuclear facial palsy of the left side. Next one, a patient with liver cirrhosis presents with breathing difficulty due to massive ascites. So some statements were given and the incorrect statement was to be pointed out. So answer to that is serum albumin ascites gradient of less than 1.1, which is the wrong statement. Next, rheumatic heart disease patient feels suffocating on lying down. He feels better while going near the window and opening it. So diagnosis is paroxysmal nocturnal dyspnea. A patient with pigmented gallstone, which is the least likely hemolytic anemia. Confusing question. It could be HBD Punjab or beta thalassemia minor. Next one, acute ascending areflexic disease in a patient. Diagnosis is AIDP, that is acute inflammatory demyelinating polyneuropathy, which is seen also known as like Guillain-Barré syndrome. So it comes under Guillain-Barré syndrome type. And next one, after parathyroid surgery, tinkling sensation is present, QT prolongation is present, Chostek sign is also positive, which electrolyte abnormality? Answer hypocalcemia. Next, to differentiate between AKI and CKD, so the answer is kidney shape and size is affected in CKD, and also creatinine levels can differentiate between them. Next one, a patient has headache which is treated with sumatriptan, so the diagnosis is migraine. Next, short 4th and 5th digits in a baby and a clinical case is given along with low serum calcium and high parathyroid hormone. So answer is pseudo hypoparathyroidism. Next, Down syndrome is due to, so answer is mosaicism can be seen. Next, patient had difficulty in switching from one movement to other with uncontrollable hand movements. So this is dysdiadochokinesis, which is the phenomenon mentioned here. Next, treatment for non-STEMI. Answer is aspirin, clopidogrel, and admit the patient. Next question, patient with high-grade fever and arthralgia, myalgia, and febrile for 24 hours. Patient also has petechiae. So this case, the most probable answer is dengue shock syndrome. Next, a patient after electric injury came to clinic with chocolate-colored urine. Which findings will be present in this patient? So answer is increased creatinine kinase will be seen. Next question, VSD and PDA after 1 month of birth in a baby, and VSD is due to non-fusion of membranous and muscular part of septum. What is correct about intrarenal damage? Answer is plasma creatinine by urine creatinine ratio of less than 20 millimoles per liter. Next, a patient has visual difficulty after drinking from a local shop, and which metabolite causes this? So answer here is formic acid. Next one, a patient is suffering from malaria and there is history of hemolytic anemia among males of the family. What should be checked before treatment? So that is G6PD levels. Next, for diagnosis of SARS-CoV-2, which test is done? Answer, real-time PCR. Next one, an alcoholic man with deranged AST by ALT ratio and fatty liver is present. What is the management? Answer, lifestyle modification, which is the first line treatment. Next one, patient with progressive increase in shortness of breath, and on examination left parasternal heave is noted with palpable liver and also systolic murmur is present. What is the diagnosis? Answer, pulmonary artery hypertension. Next one, patient with mitral stenosis, determinant of severity is S2 opening snap gap. Next, patient with history of pneumonia develops pleural effusion. So expected finding for parapneumonic effusion is answer, pleural pH less than 7.2. Rheumatic heart disease patient with pansystolic murmur is seen in answer, aortic regurgitation plus mitral regurgitation. Next is from surgery, and image is given, and the answer to that image is varus needle. Next one, a gentleman gives history of falling astride, following which he has difficulty in urination. Blood is present at the external urethral meatus with bruising in the perineum. Which of the following is the most likely injury in this patient? Answer is bulbar urethral injury. Next, radiological image with coffee bean sign. Image-based question. Answer is sigmoid volvulus. Next, a 14-year-old child with fever, night sweats, severe back pain with weight loss, and clinical history is given. Also, an image is given, and the answer is spine TB. Next, for a newborn child with respiratory difficulty, doctor evaluated and found to have posterolateral defect. Image is given, and answer to that is Bush-Delic hernia, which is the most common type of hernia. And next one, radiological image, temporal lobe abscess, an image-based question again. And next, a patient with dysphagia, more to liquids than solids, and a radiological image is also given. And the answer to this is achalasia cardia, which shows rat tail sign. Next one, chest X-ray showing pneumoperitoneum is seen in answer, hollow viscous perforation. Next, smoker with a radiological image is again given, and the answer to that is lung abscess. Next is again a radiological image, and also the patient is a carpenter. An MRI is shown of knee joint. So the answer to that is prepatellar bursitis or housemaid's knee. Next one, a patient has mass in the neck with glue ear positive. So management in this case will be answer, radiation therapy. Next one, mother feeds a child and child chokes due to an apple seed. Location of obstruction is answer, trachea. Next, when a mother feeds a 2-year-old baby, groundnut enters the bronchus. Management is Heimlich's maneuver. Next, image of capillary hemangioma is given, and what is the management? Answer is observation. Next, enzyme raised in prostate cancer, acid phosphatase. Right scrotal swelling with right hydrocele and left test is normal with enlarged pre-aortic lymph nodes with metastasis. Investigation needed is answer, high inguinal or inguinal orchidectomy. Next, cyanosis after 48 hours of bone fracture. Diagnosis is fat embolism. Next, identify the swelling on the dorsal aspect of the wrist. Answer is ganglion cyst. Next is again an image-based question, and the image is given below. Answer to that is vacuum-assisted closure. Next one, identify the structure marked, an image-based question again, right hepatic artery. Next, a patient with multiple clots in urine. Which catheter should be used? Answer, 22 French, 3-way Foley's catheter. Next, image of sebaceous cyst with black punctum in the center. Treatment is surgical excision with antibiotics. A child comes with melena with acute intermittent pain in the right iliac fossa. On surgical exploration, an image is shown. Diagnosis is Meckel's diverticulum. From the image of an ulcer, identify the marked structure. So it was marked as edge. Next one, identify the procedure. Again, an image-based question. Answer, retrograde pyelogram. Next, during laparoscopic surgery, when inserting the trocar, which of the following is most prone to injury? Answer both superior epigastric and inferior epigastric artery. Which of the following is not related to progression of basal cell carcinoma? Answer duration. A 5-month-old comes with vomiting after feeding, failure to thrive and on examination, and a leaf-shaped mass in the upper abdomen is felt. Diagnosis: pyloric stenosis. 30-year-old female comes with a lump. Histopath image shows leaf-like pattern. So diagnosis is Phyllodes tumor. An spread of prostate cancer to lumbar vertebra is by venous route. Varicose vein of grade C4A, treatment is endothermal ablation. 71. A patient with breast cancer underwent cobalt-60 radiotherapy. It presents with respiratory distress. Radiological image shows haziness in the left lung. Diagnosis in this case is radiation pneumonitis. Next, primary use of endoscopic ultrasound. An image of endoscopic ultrasound is given. So the answer to that is staging of esophageal cancer. Next one, most likely diagnosis of a radiological image showing bat-wing appearance. Answer, pulmonary edema. Epiphysis in the lower fibula is a type of pressure epiphysis. Next one, cerebral calcification in a patient. An image is given and the causative agent is answer, toxoplasma. Next one, a patient got stabbed on his anterior thigh and he died. What type of injury is this? Answer, penetrating wound. Next one, a patient fell down and got injured. He now comes with a brownish scab on it. Time of injury is 4 to 5 days. Next one, 78, MRM photo with an arrow pointing to the lateral border of MRM is given. So the answer is serratus anterior. If at all, it's an image-based question and an arrow was pointing. So it could be any of these depending upon the arrow pointing. Next one, where should a surgeon search for accessory splenic tissue after splenectomy due to anemia? Answer is mesentery and splenic hilum. A woman aged 80 years underwent hysterectomy and died. Image of bulged abdomen is given. Which vessel might be ruptured? Which of the following is most likely serious or immediate complication? Answer is bowel ischemia. Next one, repeated gastric ulcer. So, Seanan, Zollinger-Ellison syndrome. Next, a woman with lower limb edema and redness is present. So, treatment is answer, fasciotomy. Next one, a female accidentally ingested a chemical. Few days later, she developed difficulty in swallowing. Diagnosis, it could be stricture or if at all a subglottic stenosis is there, it could also be the answer. Next, a boy with a mass on the chest. It could be Epstein-Barr virus infection or squamous cell carcinoma depending upon the image. Next one, blood discharge from the nipple seen in invasive papilloma. Next, a child was brought to the burns department. Calculate the percentage of burns, 20 to 30%. 87, a patient with grade 4 hemorrhoids underwent surgery. Identify the instrument given from the image. Answer is hemorrhoids band kit, that is Barron band ligator. Moving on to OBG, a 27-year-old woman presents with irregular periods, acne and excessive hair growth. What is the first line management? Answer is lifestyle modification. Next one, home-based pregnancy test is based on. Answer, beta-HCG. Next, earliest sign in pregnancy on transvaginal sonography, gestational sac. With serious changes are not seen in pregnancy. Answer, diastolic murmur. Next is an image-based question. Answer, open neural tube defect. Next, fetal anemia is monitored by MCA-PSV. Identify the CTG pattern from the image given. Answer is early deceleration. Next, image of Wrigley's forceps. This forceps is not used in answer, obstructed labor. Baby's head is delivered but shoulders are not delivered. After how much time can we call it as shoulder dystocia? Answer, 60 seconds. Which surface of placenta is shown in the image given? Fetal surface. Identify the procedure from the image given. Answer is intrauterine balloon tamponade. A patient had forceps delivery following which she had severe pain in the episiotomy site. On examination, there was swelling and bluish discoloration. Which of the following should not be done? Answer, remove the suture in ward. Next, a woman had difficult labor and C-section. She had complaints of dribbling of urine on 7th day of delivery. Diagnosis, vesicovaginal fistula. Next, 46XX karyotype and P57 and KIP2 negative. Answer, complete mole. Correct USG characteristic in ectopic pregnancy. Empty uterus with adnexal mass with free fluid in the abdomen. Image-based question. Answer could be pouch of Douglas, which is seen in females, and if at all it was in a male image, it could be rectovesical pouch as well. So depending upon the image. Next one is an image-based question again. Genital TB is the answer. Which hysterectomy has less chance of ureteric damage? Answer is if vaginal is there, it could be the answer, and if laparotomy is there, that is also a more prompt answer. Next one, after how much time of vasectomy can a patient not use alternative contraceptive? Answer, 3 months. Next, OCP does not prevent which cancer? Breast. Drug of choice for endometrial hyperplasia, LNG-IUS. In cervical cancer, which radiotherapy is given? Platinum-based radiotherapy. A woman after 2 weeks of delivery comes with fever and bloody discharge from nipple. Diffuse lump under areola is felt. Diagnosis, lactational mastitis. Image-based sign. And answer is Hagar's sign seen in pregnancy. Which of the following drug is not used in hypertension in pregnancy? Answer lisinopril, which is an AC inhibitor. Next drug preferred in cervical carcinoma, cisplatin. In developed countries, which screening saved the most lives? Answer pap smear done for cervical carcinoma. Next, what happens to the baby of mother with gestational diabetes mellitus? Hypoglycemia. Moving on to PSM, a 5-year-old child was brought to casualty with fever and rash. On examination, Bitot spot is seen. Management, isolate and give nutritional management with vitamin A supplements. A study was conducted in 2014 with a group of 5,000 to 6,000 people to study the occurrence of a disease till 2024. Type of study, prospective cohort. Population norm for ASHA in urban areas, 1,000 to 2,500. Which of the following is included in the base of the triangle of level of health services, sub-center and PHC? In a study population of 2,200 is deceased, and out of 260 positive result, 160 had the disease. Specificity is 92.7. In a school, 75 children go on trip. Among them, 80% are vaccinated for a condition. 12 were affected with the disease. What is the secondary attack rate? 80%. Colonoscopy was done as a screening tool, and it is an example of which level of prevention? Secondary. Vaccine contraindicated in pregnancy, varicella, which is a live vaccine. Next, National Deworming Day is celebrated every year on 10th February and 10th August. Identify the larva. A. No siphon tube and larva B with siphon tube from the images given. Answer is Anopheles and QLX respectively. Nodal Ministry for Disaster Management, Ministry of Home Affairs. An epidemic occurred in a particular village because of cholera. There were 12 deaths among 60 cases. Case fatality rate 20%. Management of HIV positive. Patient with dog bite for rabies. Vaccine plus immunoglobulin plus wound management. In a study, mean value was 82 kg, standard deviation 1.5 kg, 95% confidence interval between 79 to 85. Fractional IPV dosage in National Immunization Schedule, 6th, 14th and 14th week and 9th month. Danida supported by which health program? Blindness. Which of the following is not adulteration disease? Fluorosis. Which of the following is not an STD under IDSP, HIV and HBV? Critical path. From the image, it should be the longest path. And correct sequence of adoption of practice, awareness, interest, evaluation and adoption. Tourist guide is example of herd. Pneumoconiosis particle sizes 0.5 to 3 microns. 400 low birth weight and 200 normal birth weight babies were followed from birth till 1 year of age for development of protein energy malnutrition, and data is collected between the study at regular intervals. It is cohort study. Poster in public places is mass approach. Mr. X joined Navy in 97, married in 1999, first child in 2022, and answer is 2022 extension. Next, all are advantages of OPV over IPV except vaccine-associated paralytic polio with OPV. And next is a radiological image showing string of pearl sign seen in PCOS. Next is an image showing bluish discoloration of the cervix and vagina. This is Chadwick sign seen in pregnancy. Next image, in which case magistrate inquest is preferred over police inquest. Death of a woman with within 7 years of marriage. Moving on to forensic. Fixation of postmortem lividity in 8 to 12 hours. Construction worker got injured from hammer fallen on his head, so it causes depressed fracture. A married female died within 7 years of marriage, and section related 176 CRPC and 196 BNSS. In which case magistrate inquest is preferred over police inquest. Death of woman within 7 years of marriage. Fixation of postmortem lividity 24 to 48 hours. Next, death in police custody. Inquest is by magistrate. A doctor received 2 summons, one from criminal court and other from civil court. Correct statement. Attend the criminal court. Leading questions are allowed in cross-examination. Cephalic index of 85 belongs to mongoloids. A chronic alcoholic comes with tremors, insomnia and anxiety following cessation of drinking. Diagnosis, delirium tremens. True about dying declaration, oath is not required. Phosphine gas hypoxia is histotoxic hypoxia. Pathology, histopath image is given showing follicular cells with pink eosinophilic cytoplasm and extracellular material. Answer medullary carcinoma. c-Myc gene mutation seen in Burkitt's lymphoma. A pedigree chart is given and it shows disease transmission from mother to all the children, inheritance, mitochondrial. Changes seen in irreversible cell injury, amorphous density of mitochondria. Next, timing at which triphenyl tetrazolium chloride can elicit changes post-MI, 3 hours. 60-year-old person presented with lesion on the medial canthus. Histopathology showed nesting cells with peripheral palisading. Diagnosis basal cell carcinoma. Next, 50 years presented with a mass that was operated and microscopic examination image is given. Diagnosis mucinous carcinoma breast. Next, microscopic image with lymphoid structure with an overlying epithelium. Answer is tonsil. Next, raised AFP is seen in answer hepatoma. Next question, an image with large chondrocytes and perichondrium present. Hyaline cartilage. Image of CSF rhinorrhea. Double target sign is seen. Next is a histopath image is given. Identify the cell. So that is Purkinje cell. Flipping of phosphatidylserine is seen in apoptosis. A patient with pigmented gallstone, which is the least likely hemolytic anemia. Confused one. It could be both HPD Punjab and beta thalassemia minor. Hand foot mouth disease gene, Hox gene. 60-year-old person with lesion. Histopath shows keratin pearls, squamous cell carcinoma. A child came with recurrent staphylococcal infections. A lab examination showed less levels of immunoglobulins GAME and low levels of B cells. There is no normal reaction to environmental antigens on the skin. Diagnosis Bruton's gamma globulinemia. 45-year-old came with headache and microscopic examination shows whorled appearance with samoma bodies, meningioma. Von Willebrand fracture binds to GP1B9. Dermatology. Image of acrodermatitis enteropathica is given and it's because of the deficiency of zinc. Next, an image of a patient with psoriasis is given and what sign is seen here? So it's Auspitz sign seen in Grattat's test. Next, a patient with painful genital ulcer and bilateral lymphadenopathy. Diagnosis, if it is painful bilateral lymphadenopathy, it is cancroid. If it is painless, it could be LGV. Next, treatment of acne vulgaris, answer isotretinoin. Image of a schoolgirl is a mascot for which disease? Answer leprosy. Zank smear showed multinucleate giant cells. Most likely causative organism is herpes simplex virus. Oral and penile lesions image is given. Diagnosis lichen sclerosis. A woman undergoing chemotherapy presents with rapid and significant hair loss within weeks of starting her treatment. Diagnosis anagen effluvium. For multibacillary leprosy, incorrect treatment is rifampicin 450 mg monthly, which is wrong. Pharmacology. Drug preferred for treatment of meningitis, ceftriaxone plus vancomycin. Which anti-TB drug requires normal functioning of CAG gene? Answer isoniazid. Which drug can be used in renal and cardiovascular disease? SGLT2 inhibitor. Next, a child consumed 5 tablets of paracetamol. Child was then given N-acetylcysteine. Mechanism of action of N-acetylcysteine: replenish the glutathione store. Cisplatin versus carboplatin. Cisplatin is more nephrotoxic. Drug of choice for malignant hypothermia: dantrolene. In osteoporosis patient on zoledronate therapy, we ask the patient to maintain upright posture. This is to reduce risk of esophagitis. After ART therapy in a TB patient, patient's condition worsened. Causes: immune reconstitution, inflammatory syndrome. Diabetes patient on metformin with HbA1c more than 7.5. Next step, increase the dose. Iodine 131 side effect, hypothyroidism. In a patient after giving a noradrenaline injection, heart rate started to decrease. Reason: stimulation of baroreceptors. A patient on olanzapine therapy stopped taking a drug due to side effect. Side effect is weight gain. Patient on warfarin therapy, recommended prothrombin time 1.5 to 3.5. If it is recommended INR, then it should be 2 to 3. Which of the following is side effect of prostaglandin analogs uveitis? Personalized drugs prescribed to patients depends on which parameter? Genetic makeup. To control hypoglycemia, which drug is given? Glucose oral or IV, or glucagon IM or intranasal. First line management for hypercalcemia, IV fluids plus loop diuretics. If question was drug of choice, then it is alendronate. Nitroglycerin route of administration in ICU patient, IV. Botulinum mechanism of action decreases the level of acetylcholine. Indomethacin should not be given with AC inhibitors because causes hyperkalemia. UTI with sensory neural hearing loss and the patient is allergic to penicillin. Which drug is given? Azithromycin or ciprofloxacin. Common side effect of bleomycin treatment, answer lung fibrosis. And a patient on anti-epileptic therapy developed gingival hypoplasia. Most likely agent is phenytoin. Moving on to ENT, a radiological image is given. Answer to that is a teardrop sign. Next one, Rene's test negative on right side and left side Rene's positive. Weber's lateralized to the left ear. Bone conduction is reduced in the right ear. Diagnosis, sensory neural hearing loss in the right ear. CT image with an arrow showing the drainage area in case of maxillary sinusitis. Answer osteomeatal complex. Identify the type of tympanoplasty given in the image. Answer type 4. Next, which child with past history of intubation with shortness of breath during playing after 6 weeks later comes and radiological image shows steeple sign. Diagnosis, laryngotracheobronchitis, which is also known as croup. Find the type B tympanogram from the image given, and it is the right image to be chosen. Next is an image with an arrow pointed to a sinus. Answer is maxillary sinus. Next, 38-year-old woman with hearing problems, cervical lymphadenopathy, and audiogram shows ACBC gap. Diagnosis nasopharyngeal carcinoma. Holman-Miller sign is associated with juvenile nasopharyngeal angiofibroma. Patient with merciful anosmia, atrophic rhinitis. Moving on to physiology. Person is performing weightlifting. Change seen in sarcomere, eye band decreases. Right shift of oxygen dissociation curve happens in acidosis. Balancing the body is done by vestibulospinal tract. Which of the following is not reversed by atropine? Muscle weakness. A patient presents with high BP accompanied by a decrease in heart rate, most likely physiological mechanism responsible, stimulation of chemoreceptors and baroreceptors. Next, which of the following describes the chlorine ion exchange in RBCs when bicarb levels are exchanged for chloride ions to maintain electrical neutrality? Answer, Hamburger effect. Next, which segment of nephron has the lowest osmolality under the influence of antidiuretic hormone, late distal tubule? Identify the cell from the renal biopsy image. From the image, it is to be extraglomerular mesangial cell. And if at all the arrow was pointed to macular densa, then that's the answer. Dehydration is more severe in infants than adults. Which statement is true among the following? ECF is more than ICF. Which electrolyte abnormality in a patient with severe vomiting can lead to cardiac arrhythmia, hypokalemia? During spermatogenesis, which hormone inhibits FSH secretion? Inhibin. A patient is diagnosed with Pankos tumor. Which finding is not seen? Exophthalmos. Which terminal bronchiole cells helps in removal of pathogen? Ciliated cells. Negative ion balance shows increased TIBC. Next is an image given. Answer is blastocyst. A 40-year-old woman with history of chronic vomiting due to an eating disorder. Lab reports show elevated bicarb levels and increased pH. Most likely causes metabolic alkalosis. Which of the following is involved in milk ejection reflex? Oxytocin. Moving on to microbiology. Causative agent of prosthetic valve endocarditis, Staphylococcus epidermidis. Patient presented with lesion on upper limb after rose thorn injury. Sporothrix. Culture media with green pigment. Answer, Pseudomonas. Culture media used for TB, LJ media. Microscopic agglutination test for Leptospira. Hemolytic uremic syndrome, Shigella. For diagnosis of typhus, antigen of protease is used. Type of antigen, heterophile antigen. Next one, patient tests positive for HBsAg and HBAg. Answer, HBV with high infectivity. A patient's lab results were positive for malaria antigen and viral results are O antigen more than 1 by 20, H antigen more than 1 by 300. Diagnosis is recent infection by Salmonella species. Cell wall rigidity is by peptidoglycan. Treatment of cryptococcosis, flucytosine plus liposomal amphotericin B. A patient consumed fried rice and came with vomiting after 6 hours. Diagnosis, Bacillus cereus. Moving on to biochemistry. Deficient enzyme in a small child with ochronosis, homogeneisate oxidase. 4-day-old child with 15 mg per deciliter bilirubin. Physiological jaundice. 2-year child with Bolex, normal calcium, increased PTH. Diagnosis, rickets. Which of the following carbohydrate deficiency leads to essential pentasuria? L-xylulose. Which enzyme responsible for removal of triglycerides from chylomicron? Lipoprotein lipase. Which best describes control of an enzyme activity by phosphorylation or dephosphorylation? Covalent modification. Chronic alcoholic recently reported with decreased intake of food for last couple of months, now comes with hypoglycemia. Most likely cause of hypoglycemia, inhibited gluconeogenesis. Enzyme deficiency for Natovic syndrome, hyaluronidase. Enzyme deficiency will affect collagen maturation process during collagen synthesis due to vitamin C deficiency by lysyl hydroxylase. Which amino acid acts as a buffer in blood due to its ability to accept and donate protons at physiological pH? Histidine. Hormone first released during hypoglycemic state? Glucagon. Child presents with micrognathia and Lowset ears. Genetic abnormality associated? Deletion. Acetyl-CoA in prolonged starvation used for ketogenesis. ACA-CGT is being transcribed. What is the transcription codon? Thymine is replaced by uracil. Gum bleeding seen in vitamin C deficiency. Next, pediatrics. A 3-year-old child with less upper segment by lower segment ratio. Diagnosis, spondyloepiphyseal dysplasia. If higher upper segment by lower segment ratio, then the answer should be achondroplasia. Next, a 2-year-old child comes with fever, cough and fast breathing of respiratory rate 55 per minute with no chest introing. Diagnosis, pneumonia. Which parameter affected in chronic malnutrition? Height for age. Newborn with heart defect, hearing loss and cataract, congenital rubella syndrome. When blood sample is taken for diagnosing neonatal hypothyroidism, 72 hours after delivery. Treatment for child with nephrotic syndrome, minimal change disease, steroids. Child was born to controlled gestational diabetes mother. 4 days after birth, he developed dyspnea with SpO2 of 80%. Management is 100% oxygen. And next one, for diagnosing the 100% oxygen is done for the testing of hypoxia. So it's a test, it's an investigation, but the treatment will be 21 to 30% oxygen. Next, for diagnosing UTI in a child, which sample is used? Suprapubic aspiration. A child with mid-arm circumference of 10.5 centimeter and eating food well. This is uncomplicated severe acute malnutrition. Child consumes 5 tablets of PCM. What is seen in the child? Answer, increased liver enzymes. Moving on to anatomy. 45-year-old woman with tingling sensation of lateral 3 digits with loss of sensation of base of thumb on the dorsal aspect because of radial nerve injury. Next, 3 days back, a female had injury in her 4th phalange and an image is also given. So answer is marked damage to blood vessels surrounding it if it is operated. Anesthesia. Last link in ACLS chain of survival. Recovery. Neck vein dilated and cord-like structure is palpated. Answer, external jugular vein. Next, which drug is stopped before anesthesia? AC inhibitor. And next is a clinical case. And last line is written with breath sounds not heard on the right side, but on auscultation, right-sided breath sounds are present. Answer is right-sided endobronchial intubation. Psychiatry. 24-year-old male diagnosed with psychiatric disorder has become aggressive with neighbors. He speaks rapidly and sleeps very less. He has hyperactive behavior after discontinuing his medicine. Diagnosis, bipolar disorder. Doctor asks a patient about her age. She tells her age only after telling a long story about her. Most likely thought disorder, circumstantiality. Affective flattening implies negative symptoms. Lady comes to hospital after fighting with husband. She's not able to speak. All exams are normal. She's not concerned about her health status. Diagnosis, labile indifference. Orthopedics. A 20-year-old male presented with localizing pain, which is gradual in onset and progressed over time, and sunburst appearance is seen on X-ray. Diagnosis, osteosarcoma. Identify the instrument, BB splint. An image-based question. And next one, a 23-year-old male epileptic patient comes with pain in right shoulder. Examination revealed right upper limb was adducted and internally rotated and movements couldn't be performed. Diagnosis, anterior shoulder dislocation. Nerve involved. An image is given of ulnar claw hand. Answer, ulnar nerve injury. Ophthalmology. Diabetes mellitus cataractis due to sorbitol deposition. Day-shaped pupil is seen in iridodialysis. Cover-uncover test is used for all except amblyopia. Significant difference in refractive error between both eyes and isometropia. Image-based question. Answer, Marcus-Gunn-Juving syndrome. Right-sided field defects in both eyes, but central vision remains. It is because of defect in occipital cortex, and the patient will present with homonymous hemianopia with macular sparing. An image of cystoid macular edema is seen in Irwin-Gass syndrome. Magnification of indirect ophthalmoscope 3 to 5 times. Patient has history of a flying foreign body injury to eye. Heterochromia iridis is present. Ocular findings reveal iris pigmentation, and substance most likely involved, iron. A 2-year-old child comes with epiphoria and probe reveals a soft block at 7 mm. Best treatment option, conjunctival dacrocystorhinostomy. A patient presents with eyelid crusting and gritty sensation between eyelids. Diagnosis, chronic blepharitis. Patient with proptosis that increases on bending down, orbital varices. Corneal transplantation time within 6 hours. Amplitude for near point of 20 centimeters 5 diopter. Radiology. Body heat loss during radiation therapy is because of infrared. And radiological other questions which are covered in the main subjects are the depressed skull fracture, rat tail sign, endoscopic ultrasound, JNE, temporal abscess, cardiogenic pulmonary edema, and a few others as you can see here. So that's it for the video, and all the guys who are attending the FMG, please make use of this video. It will be helpful, and this video I have prepared previously at the time of the results of the previous FMG examination. So that's it guys. Do subscribe to my Telegram, Instagram and YouTube accounts for more updated contents related to FMG and NEET PG. And there was 2 questions which are quite doubtful whether it came or not. So it is a primary mechanism behind tissue damage in long-standing diabetes. Answer, hyperglycemia. And next is a 30-year-old man with an accident presented with the following. So answer again an image-based question, and the diagnosis is anterior hip dislocation. That's it for this video guys. Still I come back with next set of questions. Stay tuned, and next set of questions, next video. So stay tuned till then. If at all you have any ideas for my next video, do tell me in the comment section. Bye.